Are you tired of your nose being the focal point of your face? Is your nose starting to affect your confidence? Well, I want to change all of that. I'll be talking about nose jobs and then I'll show you an actual rhinoplasty procedure today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today on the show we're talking about rhinoplasty. 18-year-old Terni has been feeling self-conscious about her nose and medically has been having problems breathing because of her deviated septum. So how does she fix this? She went to Dr. Thompson in the hopes that he could improve her breathing and the appearance of her nose. I want everyone to understand that when you are self-conscious, it's always best to work on those issues. So I've gone to Eric Schmidt to talk about what he has to say on this issue.
Self-esteem goes along with confidence. I think they're interchangeable words, really. But we know that people who are confident do better in life. Everything from dating to what kind of jobs they get. We, as people, can read how confident other people are. Most people don't know how they can tell that someone's confident, but they can, and typically within 2 blinks of the eye. And so I think in terms of being able to be an effective human being, reach your goals, I think self-esteem is very, very important. There's a few people that can manage whatever, and then there's a few people that are just going to be more likely to be negative about themselves, just naturally more likely to be negative about themselves. But most of us are in the middle. I think that there's some folks that have magical thinking assigned to a plastic surgery. I would certainly advise people to make sure that the outcomes that they're expecting are going to be realistic. Most often, if we're self-conscious about a part of our body, it's because of what we're telling ourselves about that part of our body, less about what it really looks like and what other people experience. Somebody, their nose might be just fine to most of us that are looking at them, but to them, they're looking in the mirror and they're seeing something very different than the rest of us see.
So let's have a quick chat with Dr. Thompson to find out a little bit more information about this procedure. Hey, Dr. Thompson, how are you?
Hi, Troy, fine.
Great. I wanted to ask you, what is rhinoplasty to begin with?
Rhinoplasty is simply nasal surgery, surgery on the nose.
Okay. It is the second most common procedure in 2012 to have done. Why is that?
It's probably partly because the nose is part of the face, and the nose can have a lot of problems, both internally and externally, with breathing problems and appearance problems. And so it's just one of those features that a lot of people don't like about themselves, or they're having trouble breathing.
They see it first. It's the first thing they see when they look in the mirror,
well,
isn't it?
Generally when we look at people, we see their eyes, but if there's a feature like the nose that is detracting from the eyes, then our eye is drawn to that.
It's also, I believe, one of the most difficult surgeries to perform.
We're talking about really a three-dimensional structure with an internal lining, cartilage on the outside. It's sort of sitting out on the face, and so there are a lot of forces pulling on it. There's a lot of functional component involved with the nose, and also there's an aesthetic component. And so getting a good result with a rhinoplasty can be very challenging.
And tell me, do people bring in pictures of what they're looking for?
Yes, I would say that's a little bit more common, but it seems that our society now is moving more toward people kind of appreciating their own personal identity, but maybe wanting to make some slight changes in their nose.
I think that's really important, because not only are people steering away from that celebrity look-like, but how do they feel that they can trust you with that?
First of all, we have a long discussion before we do anything surgical about what the risks are and what the ramifications are of doing something. But then what I usually do is I'll sit down with them with their photos, and I have a program that I can kind of alter their photo on the screen and give them an idea what it might look like if we were to do surgery. And then we know that we're on the same page, we're communicating with each other, and then going into surgery, I'm more confident that we can achieve the outcome that they want.
Terni not only needed to have her nose reshaped, but she had a breathing problem, a deviated septum. Tell everyone out there what that actually is.
A lot of times people have deviations or asymmetries on the inside of their nose that aren't visible on the outside, and these can cause breathing problems.
Okay.
And so a lot of times when we're doing a rhinoplasty, we'll also try to improve the breathing on the inside. If someone has a crooked nose on the outside, I am purely just trying to improve their breathing and working on it from a completely functional standpoint.
Do you feel that we as a society are more conscious of the way we're looking and want to have it done immediately?
The majority of people that I see are very confident in who they are, but they might have one thing. It's maybe their ears, or maybe their nose, or maybe their neck is loose now. Those are kinds of the things that they want to have improved. And I also think that because our society is staying healthy and living longer, then people are really concerned about the way that they look. They're in the workforce longer.
What are you doing to make sure that your patients that come and see you are mentally and emotionally ready to go on this journey?
No one should have surgery unless they kind of understand the whole process and the ramifications of that. There are at least 2 visits that we have that are extensive visits, and I can usually get a pretty good idea of the emotional stability of the person that I'm working with. I also do a thorough review of their medical history, and if there are emotional or psychological issues, then we explore those and we make sure that their professionals that they're working with have cleared them to have any kind of surgery that we might want to do.
Well, I think that's really important, because then people feel that you've just gone to that next level. You're helping them that little bit further, aren't you?
Yes, and that's my job. My job is to help people, and that's what I try to do, and I try to remember that.
Okay, well, speaking of someone that you have been helping, let's look at Terni's before pictures as well. What did she actually want to change about her nose?
Well, we already mentioned the breathing issue,
Yeah.
and that's something you don't see from the outside, but that's something I see when I do the examination, and that's part of it. And then the other thing, Terni had really just some subtle changes that she wanted to improve about her nose. Her nose kind of pointed downward. She has a little bit of a shorter face, and the angle of her nose was less of a feminine kind of a nose. And then she also wanted to try to just improve the tip of her nose and give it a little bit more definition.
How invasive is this?
Well, it's I guess it's fairly invasive on the nose itself, and there's about a week of time where I tell people to just kind of take it easy a little bit. Initially, you can't breathe through your nose at all because it's swollen,
so you give them
and
a straw?
crusting, and yeah, no, they have to breathe through their mouth. Really, yeah, it's a good question. So yeah, I mean, there's definitely some pain for a few days with most people. And there is some downtime, but that's about a week.
Now, of course, it's surgery, as you said. There are risks involved. What are some of them involving rhinoplasty?
Risks of rhinoplasty are scar tissue. Every surgery has scar tissue. Bleeding, infection, every surgery has that. Or breathing problems. Sometimes with rhinoplasty that's done overly aggressively, someone will suddenly not be able to breathe anymore after they've had a rhinoplasty. So all that has to be taken into account.
Where do you stand on age limit for having rhinoplasty?
There's probably no exact age limit, but in general, the patient should pretty much be done growing, and that indicates that the nose is done growing and changing as well. So usually 17 is about the minimum age when I would do something like this.
Okay. Being at that age, Dr. Thompson, would you allow someone to have it because of the nose reshaping, or more for breathing, more medical?
If I feel like they're mature enough to make that decision and have that discussion with me, I think we can kind of determine that, and sometimes I'll decide, yes, this is a big problem that's really affecting the way that the person's feeling about themselves, then I will do a rhinoplasty on a 17-year-old. And let me go back to Terni just for a minute. It wasn't that she didn't have self-confidence or that she hated her nose. It was kind of a subtle change that she wanted. She just wanted the angle change, she wanted the tip narrowed a little bit, but she still really wanted to retain her identity of her nose and the nose that her family had, and so that's very important.
Totally important. I really appreciate that. Coming up after the break, Terni will explain the emotional reasons why she wants this surgery, and then we'll watch as Dr. Thompson actually performs the rhinoplasty procedure. The following footage contains actual surgical procedures. It may be too graphic for some viewers.
My name is Terni Blood, and I'm 18 years old. My septum is deviated, which means the middle piece of cartilage right here is to one side, and it affects my breathing. I virtually can't get any air through my right nostril. I'm having the surgery today because, one, my septum is very deviated, but two, I took this opportunity to just change my nose a little bit.
Hi, Terni.
Hi.
How are you?
Good.
Good. Are you excited about this?
Yeah.
Okay. I'll be working on the inside of your nose for the first part to fix the breathing problems that you're having, and probably you have a deviated septum on the right side, and we'll get that fixed, and that should open things up pretty well. And then we talked about the outside, and we're going to lift your tip up a little bit and narrow it and give it a little bit more definition, and then just make your bridge here just a little bit straighter. She's got the anesthesia running now, is asleep. Dr. Larson's keeping track of that. She has just a little bit of a bump here on her bridge that we're going to take down slightly. Her nose is a little bit wide down at the tip. And then beyond that, she has a very deviated nasal septum, and it's causing a lot of breathing problems. So that's going to be a big part of this operation, is fixing her breathing. Okay, so I'm going to inject some local anesthetic to get everything numbed up for her, but also to help minimize bleeding. Every time we do this operation, it needs to address both the functional and the aesthetic aspects of the nose.
In the past, people have called me like rat face, and one of my best friends, he always tells me I look like a bird. I'm like, I don't want to look like a bird. I mean, I don't look at my profile all the time, but when I do, I'd like to feel okay with my own profile.
The tip's a little bit wide through here. That's one of the things that I'll be working on to make it a little bit more narrow. And underneath, we can see that the nostrils are a little bit asymmetric, and that's because of our deviated septum. It's making this nostril a little bit smaller and narrowing that side. So that's one of the things that we'll be working on. And then from the side, she just thinks her nose is a little bit long and points downward a little bit. So we want to have it a little bit more like this when we're done with it, to lift it up a little bit more and not quite as downward pointed and not quite as long. I'm going to make an incision on the inside of her nose here and expose the septum. The nose goes back a lot further than people realize usually. She has a fairly small nose, and she just has too much cartilage to fit in there. So we're working on getting some of that out of the way. So this piece of bone was way at the back, just jutting out into her airway, causing some obstruction there. So that'll really help, having that out of the way. I can see all the way to the back of the nose on the right side for the first time now, which is really nice. So she'll notice a big improvement in her breathing with this.
I'm hoping it'll improve my capacity for singing, and I'll be able to sleep better. I do sing, and I'm hoping that being able to breathe easier will help me be able to control my voice better and easier.
Now I'm going to expose this cartilage on the outside by making an incision at the base of the nose here, and we'll kind of peel this back. And now I'm just working underneath this skin envelope to free the skin up off of the nasal bones a little bit more so that I've got the exposure that I need. Right here, it's a little bit lower. It's where I took a little piece of cartilage just now, and now I'll take a little bit of bone right here with the rasp to smooth that out even more. This is just like a file. This is exactly what it is. It just takes little tiny chips of bone down. But she didn't have much of a bump before, but now her bridge is just straighter than it was.
Having this procedure done will just make me feel better about myself. And it won't be a huge life changer, but just so I can be more comfortable looking at myself.
Okay, so now I can see the septum from the front here. This thing is what was leaning over into her airway on the left side and causing that blockage. So I'm going to see if I can reposition it a little bit in a more straight configuration here. Now I can see that the deviated septum is just kind of being forced that way because there's just a little too much cartilage to fit in this space, and so it's forcing it off to the side. So we'll trim a little bit and maybe reinforce a little bit to fix that. We're going to take some of this cartilage and trim it down to make some grafts to stabilize everything. The cartilage is great. You can pretty much put it wherever you want, and as long as it has blood flow, it'll survive. So there's one on each side that I'm going to put, and that'll help to keep things symmetrical. This is called PDS suture, and it
take several months to break down, and by the time it dissolves, we'll have a stable structure here and things will be where we want them to be. Now that bow that was in the septum that was giving her breathing problems will be much less likely to happen now because it's stabilized with 2 additional pieces of cartilage to help keep it straight. We're now going to re-secure the upper lateral cartilages to the septum so that they don't collapse inward.
As far as I know, my family and friends are okay with everything. My mom supports me.
And we can see these cartilages here kind of bow outward, and that gives the nose a rounded appearance, and we want it to have a more defined appearance here in the tip, and so I'm going to see if we can straighten these out a little bit to accomplish that. Okay, so I have this right cartilage pretty much freed up completely here. It's freed up from the membranes underneath, and you can see it has this curved round shape, and I want to have it more like this, a little bit straighter, and that will give her a lot more definition to her tip. We'll add some cartilage to help straighten those out. When we were looking at this cartilage before, we were noticing how round it was, and I've just placed a piece of cartilage from the septum beneath, which you can see right there, and that effectively straightens this out, and that will help to give us a more defined tip and less roundness to the tip.
In a couple days, I'm hoping that I will see everything starting to fall into place, and I'll see eventually how everything will be and how my breathing will be, so looking forward to that.
Right now I'm just trying to position the tip so that it's symmetrical, and I'm going to put the skin down in a minute to just see how it looks. So we've taken this little bump down, and then I've also lifted her tip up a little bit, so instead of driving downward like it was before, it has more of a feminine angle. So you can see from profile, the nose is actually a little bit shorter than it was before. We're pretty close here. We'll just do a couple little minor things and then we'll be all done.
Coming up after the break, I'll bring Terni into the studio to hear what she thinks of her final results. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. Be sure to check out the Younger You website to watch full episodes of the show, stay up to date on the Younger You challenge and get useful tips and tricks to help you achieve the Younger You. Terni's decision for this procedure was mostly medical. Let's hear what Dr. Thompson has to say about the cosmetic side of her rhinoplasty, plus a few others.
Okay, so we're here looking at Terni's before and after pictures. Her main concern was that her nose was a little bit longer and almost pointed downward. We wanted to lift her nose up a little bit and make that angle shorter. And you can see in the after picture, with her nose a little bit shorter, it actually fits her face a lot better. Terni felt that her tip was a little bit amorphous and didn't have a lot of definition, and so in her rhinoplasty the tip was narrowed slightly just to give it a little bit more of a defined end point or a defined tip. Now we'll just look at a few other patients that have had rhinoplasty. In this case, again, we can see a tip that is sort of drooping downward, and this is actually causing breathing problems as well as cosmetic problems, and so some cartilage was placed to lift the tip up and give it more structure and support, and it also looks better. This is an example of a patient that has what we call a retruded maxilla, or the upper teeth are kind of sunken inward a little bit, and so this rhinoplasty was done to bring the upper lip outward, and consequently the nose came outward as well, and again has a lot better definition but also improves the breathing significantly. This is a patient that overall just felt her nose was too big for her face, and her nose is shortened by lifting the tip upward, and the bridge is also brought down to just create a smaller nose that still works from a breathing standpoint, but also looks a lot better for her face.
Welcome back to the show. Terni and her mother, Christy, have joined us in the studio to talk about her procedure. Hey guys, how are you?
Good.
All right, before we get into chatting to you about the procedure, let's just look at the before shots again, shall we? When you look at those before pictures, Terni, what do you see?
I see someone with a little bit of anxiety about her appearance and someone who can't breathe.
So when you say anxiety, what do you mean?
Just when I look at myself in the mirror, I would just see my profile mostly, just go, ugh. That sort of feeling kind of comes back.
But I got the understanding that it wasn't the main concern for you. It was more about the breathing, wasn't it, Christy?
Mm-hmm. Yes, it was. On one side of her nose, she had almost no airflow. And we, in fact, had to wait a few years from when we first recognized that she had the problem until she was old enough to get the surgery.
Earlier on in the show, we saw you describing yourself as being self-conscious about your nose. And now you said that it was more about the anxiety that you saw when you saw those before pictures, and I asked you what you were seeing there. Do those two words mean the same thing to you?
The anxiety bit was, when I looked at myself in the mirror, it wasn't how I felt on the inside. I looked different than how I felt.
Okay.
To
How did
myself.
you feel?
Pretty outgoing and...
Good. I like the fact that you've done it more for medical reasons, and that's the truth. It really is more about that. Yes, Christy, you were saying she wanted to change the shape a little bit, but she didn't want a completely whole new look, because you do look like mother and daughter, I have to say. You've got similar looking noses, you know.
The other point she brought up that I want to just emphasize is she felt different than the way that she looked, and I hear that all the time from people. I feel energetic, I feel pretty, or I feel young, but I don't look that way, and what can you do to help me with that?
I want to ask you on a pain level, 10 being the worst and 1 being easy. What sort of pain were you in after the procedure?
Well, first waking up, it was the worst. Maybe an 8.
Okay.
Yeah.
All right. And how long before you felt that you had, you know, full feeling back within the nose?
It wasn't very long, like a week or 2.
And breathing, how long did it take for you could actually feel a good breath of air coming back in?
Basically, as soon as I got the splints out of my nose.
Dr. Thompson, explain to everyone, what are the splints actually doing?
Splints are just very soft, flexible pieces of plastic that line the inside of the nose, and they help to keep membranes separated so that they don't stick together and scar in an abnormal way. And when you pull those out, that's like the first time the patient's had a breath of fresh air, and it's usually pretty dramatic. They're like, wow, this is amazing. And then on the outside, it really takes about a year to get to the final cosmetic appearance.
That's what I was about to say. When you say cosmetic appearance, is it she's not swollen now, is she? Or she
yes,
is
she actually
still a little bit
still
swollen?
is. Yeah, I mean, within a month, probably, you know, 70% of the result is there, but there's another 30% that'll happen over the course of a year. And once you get to a year, all of that scar tissue is gone, your body remodels and gets rid of that, and then you can kind of see the underlying structure of the nose better.
I'm looking at Mum, and I'm thinking to myself, would you allow her to have any other cosmetic surgery done?
If it's something she feels very strongly about, I would be behind her if she wanted to do it. If it was something that was outrageous or not healthy for her, we would have a lot of discussion on it.
Would you do anything again, Terni? How do you feel about cosmetic surgery?
I think it's great if, you know, there's just a little something that you want to change. And
Dr.
Sometimes
Thompson?
it's a dramatic something. It's not always just a little something.
I know,
you know?
I know. I don't see a huge change in her nose shape. Okay, so I'm really getting the impression it was truly about breathing. When some kids or some young adults come in and they have more dramatic changes, what are they asking for?
I would say rhinoplasty is probably the #1 most common thing
In
for
your
young
surgery?
adults. You know, they either have a breathing problem or they have a cosmetic problem that really detracts from the rest of the face, and it is a fairly dramatic thing.
I want to ask you a question. Do you still have anxiety?
I mean, in general, just
In
about
general,
life.
we all have it. We all have it. But I'm just saying now, you're feeling great.
Yeah. I look in the mirror and I'm like, that's me. And I can breathe better and sleep better. So.
I think that's great. Dr. Thompson, when patients come in to see you, or the people at home watching, they want to ask the questions to their cosmetic surgeon. What are the top 4 questions that they should be asking?
The number 1 question you should ask any surgeon if you're considering surgery is that really something that you're specialized at? How often do you do that procedure? Do you do a lot of other procedures as well, or is that something that you're really competent at and focusing on, especially with rhinoplasty, because it is a challenging procedure, as we discussed. Number 2 is making sure you are communicating with each other. What are you going to do to my nose? What changes do you think I need from the inside and the outside, and make sure you're communicating well. Number 3 is making sure you understand the whole process, asking all the questions about recovery, downtime, results. And then number 4, I really think that you have to have a feeling that that's the right surgeon for you when you're all done with everything. No matter what they tell you, you have to go with your gut. That's important. It really is.
I think that's a very good response for that last one, knowing the right surgeon. When you went to see Dr. Thompson, he's just as amazing in the office as he is in here, isn't he? He really has an incredible bedside manner.
Yes, he does.
Did you feel completely confident seeing him?
Yeah, I think he's very personable and welcoming, and makes you feel confident about what you're doing.
Yeah, we love him here. Thank you so much for sharing this. I know I asked you a few questions that were a little bit harder to answer and a little bit personal, but I appreciate you sharing with everyone the procedures that you've had done. Thank you, Dr. Thompson. Thanks for joining us today. I believe that cosmetic surgery can help people on a much deeper level than vanity. Procedures like this can be used to help give people not only their confidence back, but also their health. If this is one simple thing that makes you a happier person, then why not do it? For more information about Dr. Thompson and our show, please visit our website at theyoungeryou.tv, and I'll see you next week.
Coming up next week, we'll watch as Kurt gets his varicose veins removed and learn why this isn't just a cosmetic procedure. The Younger You set provided by Madison McCord Interiors.